I'm Shireen Ghorbani. It's Shireen, last name Ghorbani, and I'm the interim president of Planned Parenthood Association of Utah.
Thank you so much, Shireen. So I would love to start with sort of your view on Planned Parenthood's mission.
Yeah, so Planned Parenthood Association of Utah is committed to providing highly accessible, low cost, high quality healthcare, in particular, sexual and reproductive healthcare to Utahns.
Thank you so much. So I know we're talking specifically about the closure of the St. George location, but there's another one in the state as well. When it was announced that Title X funding would be frozen, did you first and foremost anticipate that happening?
So, Planned Parenthood Association of Utah experienced a similar situation in the previous Trump administration. The way that they went about it in the previous uh, term was different. So I would say we were expecting that there would be a timeline by which this occurred. But what's different in this case is this is action that's being taken by the administration. Congress is not involved in this at all. And it happened very quickly. So with very little warning, with very little communication, we received this notification and had to move very quickly to address really what is $2.8 million being withheld from Utahns who have relied on that funding to access low or no cost birth control, STI testing, cancer screening. That is what's happening here. So last year, 26,000 Utahns received low or no cost care because of this promise from the federal government. And now the Trump administration is withholding those dollars, meaning that we have to make significant decisions, and we know that that's going to have an impact to patients across the state.
Thank you for that. When it came to kind of assessing the funds that you do have and which clinics would have to close, how did you decide on the two that ended up closing in Logan and here in St. George?
Yeah, so really we're thinking about this as a consolidation of resources. We love those communities and we have been grateful to serve those communities over time. We also know that there are challenges when we have, further and further distances between our clinics. Just an operational challenge that is it's difficult and has been exacerbated by the Trump administration's withholding of these funds. It forced us to make decisions quickly. And I have to say, of course, for us, it's heartbreaking. These are our colleagues. But the biggest thing that we are thinking about across all of these across the different clinics is what happens to these patients who have relied on this care, who have had the support from the federal government, have now had that taken away.
Here in Southern Utah, our next closest Planned Parenthood is in Nevada, I think 120 miles away. What risk does that pose to women that do get their health care through Planned Parenthood now that they have to travel an extra distance? Some already traveling from other parts of the state just to get to St. George, now
Yeah.
having to go out of state.
So I want to add that we are able to continue to prescribe birth control via telehealth. We have some basic services that we are able to provide. Last year, we saw patients in 28 out of Utah's 29 counties, and we didn't have a physical footprint in all of those places. So we are really committed to trying to figure out how we reach as many people as possible and provide care for as many people as possible. But I want to talk about your question, right? Which is what happens when people have these additional barriers. But underlying all of this was the Trump administration's decision to withhold these Title X dollars. So if people have the financial funds, the time, the ability to move to another location. So they are either able to go to Orem and see, Planned Parenthood Utah, or they're moving to Las Vegas. The underlying issue is that those dollars that they relied on for the low cost care have been taken away from them. So if they go to another location, it's not a guarantee that they're going to find the financial support that the federal government previously provided. So on to your question of the challenges. We know that when people have either, funding support withdrawn or they have to travel greater distances, that people defer care. And we're very concerned about that. Luckily, the community of St. George has some wonderful community health centers, but those are also under attack from this administration and have seen cuts to funding. So we're talking about cuts to research, talking about cuts to education, talking about cuts to community health centers, and cuts, in this case, withholding of funds to Planned Parenthood. What we're seeing is this administration is taking a wrecking ball to public health infrastructure, and the consequences of this are going to be devastating.
Thank you so much for that answer. I really appreciate that. Um, I know that this is a freeze. Do you have hope that this will be unfrozen at some point, given sort of the Trump administration's explanation for the freeze? Do
Yeah,
you
no,
guys
we,
have hope?
yeah. We do not have hope that this will be unfrozen. Unfortunately, we're seeing, as you've probably been tracking some of the attacks that are happening on other sectors of public health, dollars that are being clawed back for public health infrastructure, for testing and tracking, folks with STIs or other communicable diseases. This is the mission right now in terms of undermining and dismantling the public health system in this country. HHS has been asked to cut $40 billion. We're talking about $880 billion in cuts to Medicaid and Medicare. We simply do not believe that the Trump administration is going to change their mind. Their leaked budget came out and Title $10 were excluded. So we do not think that there's a path back for this funding.
Do you anticipate this impacting more locations?
So I can tell you that we are working very quickly to make sure that we have support and the kind of resources that we need. So we are asking donors for support. We are, making sure that communities understand what it means to continue to basically, complete our mission, making sure that our doors stay open, that people have access to the care that they need. And we have to also mention this is a deep impact to education as well. Title X funding also supports our education efforts. We know that this is a state that already lacks in education, sex education, maturation education. So there are additional impacts that we know are occurring in this state because of the Trump administration's decisions, and we are doing everything that we can to keep our doors open.
I want to ask about the services provided specifically here in St. George. What do people go to this specific clinic for?
Yeah, so the St. George Clinic is a family planning clinic. And what that means is that we are able to provide STI screening and testing treatment. We're able to provide birth control. We can do some limited fertility support and testing. We are able to do cancer screening and treatment in some cases. So what we are doing really is creating access to that first step into people's healthcare. A lot of the patients that we see, the vast majority are under 30, and we know that these folks often don't have a primary care physician or a doctor that they regularly go to. So this is a place where they have relied on to be able to come and seek that sort of basic access to care. And what we know is that people often utilize that clinic to make sure that they are spacing and planning their families when they want to have them. This is really essential healthcare, and we're talking about access to birth control.
And then just to clarify, there's no abortions provided at this location.
Nope, it is a family planning only location.
So people that are losing services here, they're losing healthcare services. Is that?
Yeah, so
and abortion is healthcare as well, but
healthcare as well. But just to be clear, this is a clinic that focused on family planning services, STI, cancer screening, STI treatment, and testing, birth control access. That is what the St. George Clinic did, and that is about 98% of what Planned Parenthood provides in this state.
And then I know that Utah Tech is right around the corner. I was speaking with college students today, many of whom are distressed about this and the fact that they may not have access to things that they need, that they cannot get elsewhere or cannot afford to get elsewhere.
Yeah.
Community is so close and tied to young people.
Yeah.
They seem very vulnerable from this. What are your thoughts? What are your thoughts on that?
Yeah, I think that this administration is making this country a more vulnerable place for anyone who finds challenges accessing healthcare. So yes, this is something that is directly impacting, especially young people who are, in their kind of early years of their reproductive journey. It is really important for people to get information and access to high quality care. The Trump administration simply does not support access to low-cost, high-quality healthcare. But the impacts do not stop with us. We are also seeing attacks on rural healthcare and some of these basic services that are provided through county health departments as well. Unfortunately, I think Utahns, especially young Utahns, need to understand this is just the beginning of a deeper dismantling of access to public health services in this state and in this country.